Hello, my name is Jason Strimling. Today I'm going to be discussing encephalitis as it's a branch of infectious diseases. So let's get started. So, what is encephalitis? This is a condition in which our brain's parenchyma, that term meaning the functions which are primarily located in our temporal lobe region right over here, are going to become inflamed by bacteria or viruses, which is often correlated with meningitis. Yet, the ability of the different viruses to infect our central nervous system varies greatly. I say this because we have to take into account the various external circumstances as well as how strong the host immune system can be. Now, encephalitis, on the other hand, is a rare condition. However, it can actually be very dire when it strikes, leading to personality changes, weakness, and other signs and symptoms which I will be getting into later on, depending on the portion of the brain. The people at the highest risk would be the elderly, children, and those with the weakened immune systems. Continuing, let's now look at the causes and effects of encephalitis. So, there's various types of this disease, including of which can be the tick-borne, rabies, and the JEV, also known as the Japanese encephalitis virus. This in particular is the most common cause of the vaccine-preventable encephalitis in the Western Pacific and Asia. Thankfully, the risk of contracting JEV is very low for most visitors that are visiting Asia, although it does vary according to the location, duration of the trip, time of year, and activities. The majority of those that do get infected with JEV thankfully show no symptoms at all or are very moderate ones. So, how in the world are we getting encephalitis? This is coming through mosquito bites, and it's more prevalent in regions where these insects are more active. The human infection is asymptomatic, but it may cause serious illness or death in very rare cases. Another great thing is that it's not contagious between humans or animals. Looking at the effects, in regards to tick-borne encephalitis, this can cause fever, severe headaches, disorientation, and convulsions in a tiny number of those afflicted. It once again can cause the inflammation of the brain, leading to swelling, which then causes headaches, mental confusion, sensitivity to light, seizures, and a stiff neck. So why is encephalitis so significant to public health? It's important to public health because it provides our healthcare workers to do much more research and even figure out what is influencing and causing encephalitis. It then can enable the measures that we need to be taking to manage this disease. Now, I know some of you may be thinking, well, what exactly are those measures? To be more specific, these measures can include us humans taking a vaccination, which will actually lessen the infectivity. And in regards to the ticks and other insects, those can be reduced by either clearing the land and spreading the enemies of those insects, or simply dusting them with the insecticides. Moving to the statistics, there is conflicting information. It's conflicting information because the reporting procedures are neither uniform nor properly followed, so it makes it hard to determine the real incidence of encephalitis. Through the CDC, they receive reports of several thousand cases of viral encephalitis each year, actually. Many topics remain unsolved, and there's various clinical difficulties that still persist in the encephalitis research. In about 3.5 to 7.4 instances per 100,000 patients in years is the approximated number through this disease. Yet, this is often mentioned with caution because of the wide accuracy range in the diagnosis and reporting. Through the healthcare expenditures alone, it's projected to be between 630 million and 2 billion each year in the United States. With the different clinical manifestations and the wide range of variations that people are giving through encephalitis, it complicates its diagnosis greatly and the treatment. Yet, despite all the differences, there's some things that we can keep in mind. Most patients that have encephalitis are hospitalized and have a dismissal prognosis. Through that, the inpatient death rate is between 5 and 20%. Although this number isn't significantly high, it's not low, and it's not a good number to be at. Even with this and adding on, the neurological impairments and functional difficulties typically still persist in the survivors as well. Now, what can we do through encephalitis if we have it, right? There's honestly various strategies that have been used to prevent and actually improve individuals who have this disease. Our healthcare providers and other stakeholders actually developed a vaccine that has been used in order to prevent people from contracting this disease. Following, another method would be controlling the breeding areas of causal agents, for example, the mosquitoes and the ticks, by making sure to clear the bushes and using the insecticides that we may have on hand. Finally, one more method that can be used to prevent encephalitis would be to make sure that we have mosquito repellents on and use nets to protect ourselves from getting the disease. Now, let's say we have it, right? It is very, very critical to make sure we get the treatment as quickly as possible and to make sure it's detected. Now, the treatment's main objective, though, is to make sure the swelling in the brain is minimized and to avoid any more problems. I mean, as we can see here in these figures, we can look here at a normal brain, right? And then we look at one with encephalitis. As you can see, I believe it's attacking the temporal lobe right over here, also the top of the brain. So this, we do not want that. We do not want the brain with encephalitis. Through the doctors, they can prescribe medications to treat the infections we may have, the convulsions, the fevers, or any other illnesses that would follow. Thankfully, early treatment has actually been proven to improve the outcomes in our patients with the worst prognoses. So again, it just makes it very, very crucial to identify the disease when we can, because even if we are a patient who is known to be a high risk, it makes it that much more important. To conclude, encephalitis does continue to offer several complications concerning the diagnosis and therapy, as I discussed recently. Despite even our powerful imaging and our genetic technologies that are accessible, it's not quite enough to make sure it's 100% recognized. Encephalitis inflicts a burden on healthcare and the overall world economy. I mean, even our new encephalitis agents, such as the JEV and others, are rising in frequency, increasing the difficulty once again of trying to treat the disease. However, there are various approaches used to reduce and prevent this condition, which is a great thing to look at. Finally, these are the references for my in-text citations and the photos that are shown. I hope you enjoyed learning about encephalitis, and I hope that you learned some great information.